I'm Dr. Scott Schlesinger, the founder and one of the neurosurgeons at Legacy Spine and Neurological Specialists. And I want to welcome you as a patient to our clinic. And we have a multidisciplinary approach with specialists in neurology, neurosurgery, physical therapy, with a common goal of providing a comprehensive team approach to your neurological and spine condition. And what we hope is to be able to provide you the most minimally invasive both diagnosis and treatment of your condition of the spine, peripheral nerve, brain condition in our team-based approach. So the number one diagnostic tool that we're taught in medical school by far is the history from the patient, the history of their problem, the history of their past problems and medical history. And so the key in our diagnosis is your story. What's bothering you? And we need to get as much of that information from you as we can. And the best way to help you is to get that in advance through our patient portal, through our website. If you don't have any internet access at all, we offer an interactive voicemail line, which is very efficient. You can call our voicemail interactive patient registration phone number, and through that line you can give us details of your medical history of the current problem and of any past problems, of medications that you take, of surgeries that you've had. And then we can prepare. We can try to get your records. We can get reports of tests you've had done related if you will make sure and let us know. If this is not done, then your experience at the time of our office visit can't possibly be as good as if we have this information in advance. The second most important part is your physical examination. And that's only useful, of course, in conjunction with your history. So we take and evaluate you by testing your strength and your balance and watching you walk and move. If it's spine, it of course depends on what it is you're complaining of, but that will be the focus of your examination. But we will take those two bits of important, essential information. Then we'll look at, do we need testing? Do we need an MRI? Do we need electric testing or EMG, nerve conduction test? Do we need an angiogram or a myelogram? And if we need one or all or none of the above, then we'll convey that information to you by way of what is our plan? What are we going to do for you? Conditions can change over time, and what we feel is the problem or the best treatment may change over time, and we want to engage you in that understanding. Our relationship, we hope, is one of a long-term relationship between us as the provider and the medical clinic and you as the patient. And we don't make any attempt to sell you, well, this is a one-time diagnosis and treatment plan and this cannot change, this is it. That would be a huge mistake, and we certainly hope that you would understand that that is not the approach that we take in our clinic. And we'll participate in keeping us informed if symptoms do evolve, and being understanding if our treatment recommendations change over time. You may be referred here and told by your referring doctor's office that they will mail us the images or report, and I want to encourage you to please bring the actual, if you've had a disc made from an MRI in the past or any tests and images, please bring them with you. As a new patient to our clinic or even an existing patient coming back again, we want to encourage you to participate and communicate with us through our internet system of a patient portal and or through our website, which is very effective means of communication. If for any reason communication breaks down, please feel free to contact our administration through admin@legacyneuro.com or contact us at legacyneuro.com and let us know you're having a problem in communication with our team. Hopefully this will never happen, but it's certainly a possibility, and we want to make sure that you know that you can reach us and reach out to our management team anytime you need.